on this quote, because we did go as public health majors, so resources and living that way was something that we really focused on when we went there. So this was our first day. Do you want to talk a little bit about traveling?
So we left from San Antonio and did like a 30-minute plane ride to Austin, and then we took another plane ride there from our layover into Guatemala, and it was a long day, long night. We didn't get into Guatemala until close to midnight, with our host family having to like wake him up in the middle of the night and do that. But it was a long day. It was a good day to get to know the people on the trip if we didn't already know them. Because I'm not a public health major myself, so I didn't really know who was going on the trip or anything like that. I went as my medical humanities minor, and so it was good to like kind of see who was on the trip, kind of get a feel for how they were, and it was good to just relax and get like the jitters over going to a different country. So
it was a great first experience for me too. I had never left the country. I hadn't been on a plane in a couple of years either, so the travel was a lot of fun. And these two photos for day one, this is kind of like the view outside of the house. Many of the houses and the structures of homes in Guatemala, the house itself has a gate, but then everything else inside is outdoors, and you have to come outside to go into the kitchen or come outside to go into the bathroom or the living room. So this is inside the house, even though there's no roof and it's open. So this is where we stayed. Our host was Mario. He actually runs a program called La Casa Matilda. He opens up his house for students and other people who study in Guatemala or come here to do research and work for the city. So we got to stay with him, and we had two other girls that stayed with us, and then we kind of put in some pictures of our food that we were eating in Guatemala. Lots of fruit, vegetables, chicken, rice, guacamole, black beans. What else did we eat?
And he was a good cook, like he was a good host. It was really nice. He would talk to us, and he definitely, like, they were instructed in the program not to speak English, to like really force us to like learn Spanish and everything. So I know it was really hard our first couple nights there, trying to like conversate with him at dinner, because we were all so embarrassed that we couldn't speak a lot of Spanish to him, but we didn't want to speak English because we didn't want to be rude. And so we definitely, like, we had a lot of silent meals and like a couple minute conversations until we sat during our language classes, which we'll talk about in a little bit, and literally got like lists of conversations and like started talking like how we could ask questions, like what he would kind of respond to, and kind of have like fake conversations in our language class to help us learn so we could conversate with him better at dinner, because we really wanted to have him part of our experience, and he was a great host.
While we were there, part of our education before going into the community and helping, obviously we needed to learn a little bit more about Spanish, learn more about the culture, be more experienced. So we went to a program called Maximo Nivel. They're international study abroad schools. There's different locations, and this one happened to be in Antigua that we worked with. The woman in the blue up above is Gabby. She was our language professor, so we spent 4 hours a day with her for about a week and a half studying Spanish and practicing. But one of the great parts about going through this program is we used a lot of our Spanish like out and about with her. So we went and had to learn how to purchase things and how to talk in Spanish, and she would help us. We even went and bought boots together like as a class, and we had a lot of excursions during class time, so that was a lot of fun for us to prepare before we went out into the community.
So another big part of this trip is because it was a public health trip. We worked in clinics while we were there. So there were 9 of us on the trip, I think. And we all got split into little groups, pairs, and then one group had 3. And we were all in 4 different clinics. And mostly the clinics consisted of us triaging patients. So I know like what the clinic I was in, which was actually San Antonio, which I thought was cool, was that we took blood pressure, heights, and weights of all the patients when they first came in to the clinic, and then after we finished all the triaging, we would go into another room that was called the immunization room, and that's where all the children were coming in to get their immunizations at different times, and they had like their own books that they had to keep up with, which is like their chart, and so like the parents had to bring in their charts for themselves, and they had like a really organized like chart system that they used for everyone else for like the actual clinic. And then after the immunization part was done, if like we'd seen all the kids, we would go into like the family planning room where we would see adults and see if they're sick or anything like that. And we would also go into the pharmacy that they had there. And their pharmacy is not like our pharmacies in these clinics because they're cities, not like a major city like Antigua is they have like a CVS kind of pharmacy, and these like I walked into a room out of the doctor's office and all the medicine is just there. And I just walked back there and picked up what I wanted. I didn't have to like write anything down. That was something we found really interesting. Was like she handed me a list of things and I just went back there and grabbed everything and they carried it back through the thing with my arms. And so it was a really different experience. But it was really cool to see the patients and everything. And I know the nurses we worked with were teaching us how to like give shots to different patients and what they were for and what the medicines were for that we were using and everything like that. And so
it was pretty difficult too because we were learning how to do these things because we weren't nursing students. Most of us had had experience working in a clinic and we were learning how to do these things in Spanish. Because we were Americans, it was also very different that they just thought we knew everything and would hand all of us all this responsibility to take care of patients and weigh babies and give immunizations. So it was a really big different experience for us. This photo, I put it in there because I just thought it was so interesting. This is the family planning room, and that ice chest up there is where they keep all the medicine and the vaccination. So it just shows you the difference in their clinic. This was personally one of the ones I went to in Ciudad Vieja. It was more of like a poor area, so this is the typical clinic that you see for them. And then the lower hand side is the book, so that's how they keep records. Everything is on paper. They haven't been using the computer for any of their clinic work. We also volunteered for, when we left Antigua, we went and stayed in a village in Santiago Zamora. It's a much more poor area compared to Antigua. Antigua is more of a city, and this is where we went. Santiago Zamora is a village. Dr. Cuyan, he worked in the hospital in Antigua. He has a staff that he brings with him once a month to Santiago Zamora, and they open up a free clinic. So they make an announcement through this big speaker to the community, and then families and children start coming in like during recess and their time off to get treatment. So as students, we kind of rotated in different areas helping out. We taught how to brush your teeth, the importance of hygiene. We handed out toothbrushes and toothpaste. We helped Dr. Cuyan see his patients with their blood pressure, weighing them, checking their temperature. We gave medicine for vitamins. We did what was it?
We did the parasite medication.
Parasite medicine.
Yeah, so they would rotate in and we would wash their hands and teach like them the importance of that. And then we also gave them their parasite medication, any vitamins that they need through like the different age groups that they were in. So we would learn, they would talk about them what their age was and like whether they've had the parasite medication. And so it was a lot of like learning the different things that we needed to talk to them about in Spanish. And while we were there also, we were each supposed to do a presentation over a public health need for them. So we researched during our time in language class in each of the presentation over something that would be useful and that would be a need. So I know me and Jasmine Rosser, we did a presentation about the importance of hand washing, when to hand wash, why it's important to hand wash, and what would be the most like appropriate times to do that. Because I know like that is a lot of issues with like parasites and like that is not having the best hygiene, not having the opportunities to do everything. And so it was really cool to see what they actually like knew, because a lot of the kids were always like, yeah, we do this at school and stuff like that. And so it was really neat.
It was definitely an eye-opening experience for us. This clinic was, I think, hard for some of us to work at, especially. We put this photo in because it was a really great day. We had children come in who wanted to get a toothbrush, toothpaste, to get some vitamins, and they didn't even have any shoes and had been going to school and running around. So we had some donations and we were able to get them some new clothes, give them a little bit of a shower with some baby wipes, and get shoes and clothes for them. And so that was a really great experience to see that. And then personally, one of the days when I was at the clinic in Ciudad Vieja, I got to experience an amazing cultural festival that I had no idea was going on, because the clinic was completely dead. We didn't have any patients. And then we started hearing like firecrackers going off, and so we took a walk down the street, and a festival was going on while we were there. It was Corpus Christi, and it's a festival to represent the body of Christ in the Eucharist, and the wine being the blood of Christ, and it's a huge celebration. So I threw in some photos because it kind of shows just the culture and what's important to them, since it's their national religion, being Catholic. This is one of the churches that was in the Vieja, and then they had some shrines out. They decorated all of the town outside. It was just a really amazing experience to be a part of in the festival.
And so another part of our trip was over the weekend. We did, not just over the weekend, but I know our big part of it was over the weekend we went to Tikal and saw the Mayan ruins and got to like adventure out. We went up like the Caribbean and went to Livingston and had dinner and stuff. And so it was really cool to see the different cultural aspects of everywhere. And we went, like she said, we went out into different villages and purchased boots, like handmade boots from different stores. And we went to a coffee plantation to see how coffee's made and really like get into those experiences. And I know one of my favorites, just because we had a lot of fun, was the coffee plantation. We walked around and our language teacher Gabby was with us, and she was really cool to hang out with. And so we learned a lot about like the different coffees, and we hung out with her and like got to walk through the actual plant and like see how everything's made.
We had a lot of adventures while we were there besides working on the public health. We're wearing our shirts that we bought in Santa de Zamora. We purchased them from the family. They have a women's cooperative, so these families in the village make these clothes and then bring them to the home and they sell them and all the money goes back to the family directly. So we bought a lot of stuff from there, and my mother and her family is from Guatemala, so it was really great to get to see where my grandmother was from. And on our last day there, we got a cultural immersion experience in the family. So we all took turns kind of experience everyday life of being in the village. So I learned how to make my own coffee, how to make tortillas. Charley learned how to make fans and mats, which is this mat here, and they sleep on it as a bed. We watched the women make the clothing, and we got to practice trying to do it. It's a very hard day-to-day life. It really is.
No.
Yeah, and that was our experience.